Good morning or good afternoon, everyone. This is Sophia DeLeviore with the Reproductive Health Supplies Coalition. Thank you for joining us. We're going to get started in just a couple minutes. I just wanted to welcome everybody to the line. Okay, good morning, everybody. Thank you for joining us. This is Sophia DeLeviore again with the RHSC. We're really happy to have everybody here. So just a quick housekeeping. All attendees are in listen-only mode for the duration of the presentations. We're going to do 2 presentations during which you can write in your questions into the questions box on the webinar platform, and we'll address those during the question and answer. If we can unmute participants during the Q&A. We'll see how we're doing with background noise. With that, I will turn it over to Elizabeth Wesley, our MDA chair.
Hi, good morning. Thank you, Sophia. My name is Elizabeth Wesley. I'm the chair of the MDA Working Group. MDA is the Market Development Approaches Working Group. And we are, can everyone hear me okay?
Yeah, we can hear you, Elizabeth.
I'm going to assume so. The MDA Working Group is the group that focuses the most within the coalition on the total market and the private market and sustainability issues. So the themes of sustainability and access go across the whole coalition, of course, but within the MDA working group, we're really focused on the role of the private sector and of the commercial sector, social marketing, and how the whole market functions. So I just wanted to thank all of the speakers, and of course, Julia White and Sophia Della Fiore for organizing and shepherding this whole process. Julia, I believe, will talk about the next webinar that's coming up at the end. And with that, I don't want to delay. I'll turn back over to the speakers. Thank you.
Thank you very much, Elizabeth. This is Julia White. I am with the Reproductive Health Supplies Coalition and a Secretariat member who leads the Market Development Approaches Working Group from the facilitation side. I am very happy and excited that we're having this webinar, and I thought it would be useful just to remind everyone who was part of preparation for the general membership meeting of RHSC that was supposed to take place in Dakar and that was postponed, where this webinar is coming from and how it fits with where we're going to go in preparation for the postponed meeting, which will take place in Belgium in March. So essentially, what the agenda for Dakar had been was that we were going to start by setting the stage for why the private sector is important and talking about sort of the niche the Market Development Approaches Working Group has within the community and within the coalition of really focusing on the private sector and what it can bring in terms of reaching funding gaps and fulfilling sustainability needs to ensure financing for family planning. Given that a lot of our other working groups and a lot of other groups are focused on the public sector and ensuring that as a means to financing family planning. And so as many of you know, we did a meeting and focused on that the last meeting we had, and just reminding people of that work and our focus on the private sector. The agenda in Dakar was then going to move from that to talking about approaches to understanding the market, which is what we're now focusing on today, and then market data and trends, which will be the webinar that we're proposing for next month in February, and then was going to go on to highlighting select solutions and interventions, and what we as a group, all this would build towards sort of brainstorming what we as a group would like to focus on moving forward in 2018. And so essentially what we've done is we've asked this group, which is the different approaches to understanding the whole market, to present in a webinar, and then the trends and analyses will be presented in February. And then in March, when we have the general membership meeting, since it will be a postponed meeting of only half day, we will basically use that time for our interactive sessions on highlighting select solutions and interventions and having our brainstorming session. So basically this webinar is fitting into that whole flow and is taking the place of what we had initially planned in Dakar. And so with that, I'm very excited and pleased to announce Mary Warsh from TSI and Chastian Mann, who are both going to be presenting now on understanding the total market. And Chastian will be the one starting. So over to you, Chastian.
Thank you, Julia. Hi, everyone. So I have a consulting company called Mann Global Health, and we were hired by the Gates Foundation to go look at condom markets in Africa. The question around condom markets was how in a climate where donor funds are declining, how can you go about making condom markets more sustainable and more equitable? So with that, I'm going to jump right in. So the way we're going to talk for the next 20 minutes or so is to look briefly, briefly at trends in condom use and condom funding. We're going to talk about total market approach, market development approach as it relates to the condom world, and then briefly some recommendations and tools that we used. The reason we thought this would be interesting is that while every commodity market is different and has its own unique characteristics, and every country's market is different, there's some common themes and threads that emerged, and this seemed to be sort of a nice illustration of ways that you can start to understand a market by using some basic research and analysis. So in terms of condom trends, I imagine those of you who work in HIV as well as family planning will not be surprised by any of this. Condom funding is declining across the globe for HIV as well as for family planning. And disturbingly, and I'll show you some data on this, but disturbingly, we're seeing some trends that point to condom use as declining as well. In some countries, what you're seeing is a plateau. So after many years of donor investment in condom programming, even with condom funding remaining steady, use is declining, and particularly among priority populations. We're seeing an increased interest on the part of donors in particular, but also by some governments, in trying to bring more commercial activity into condom markets. And we think that there's some potential to leverage existing initiatives and support for these market development approaches for condom programming. So as a reminder, when we talk about condom markets, and I know this is a group of people who are pretty savvy on the idea of market development, but when we talk about condom markets in a country, we are talking about the public sector, social marketing, the private sector, NGOs, any kind of action that is taking place in a country is around condoms is part of a condom market. So what you see here, what you see here is you see for 4 of the countries that we looked at, and with Gates funding, we looked at 5 countries. With USAID funding, we looked at an additional 3 countries. What you see here is 4 of the Gates funded countries we looked at in terms of distribution by funding source. You'll see that it's a lot of USAID and Global Fund, a surprising amount of UNFPA in 2 of those countries, very, very small private sector involvement in condom markets in all of these places. Now, looking at use trends. So what you see in this slide is the green part of the circle is the universe of need. So we use the UNAIDS Condom Fast Track tool to determine what condom need is in any of these countries. The inner circle, the kind of yellow color, is what condom use is. And this is actually based on distribution data. So if you look at a country like Kenya, you might say, hooray. You know, the circle of universe of need is not too much bigger than the circle of condom distribution and use. The problem with that is that that masks the quality of use. So 78% of condom use in Kenya doesn't tell me whether priority populations, high-risk populations are using condoms. It doesn't tell me if people are using condoms every single time. So while that is kind of an encouraging metric to look at, it's not the only thing we need to look at. So in these graphs, what we're looking at are different examples of decreasing or stagnant condom use trends. So you see it's gone down among women, young women in Uganda. You see the others as well, that you've got use at last sex with non-spousal partner among young people in Kenya, and it's divided by men and women. So overall, there's some declining trends that are quite worrisome. And these trends in use are happening even in cases where funding has not declined. So disturbingly, even in cases of high-risk sex, you are seeing declines in use, as you do here in Tanzania. You are seeing a rural and urban divide, which is not going to be a surprise to anyone. Nevertheless, it means that we haven't solved issues of supply chain and distribution in these countries. And again, not surprising, but much higher use in the higher wealth quintiles than in the lower wealth quintiles. Something that none of us, you know, would think to be an alarming trend, other than the fact that we've been trying to work on this as a community for many years and we still haven't solved it. So here we want to look at we're going to use some terms interchangeably. And I had a conversation with some colleagues last night who work in this field, as we all do, about language and definitions. So whether we call something a total market approach or a market development approach, I think too often we alarm people with some of the market language that we use, and we draw distinctions which are important, but which may not be easily understood outside of our small circle of people who work in market development. So you will see me throwing these things around a bit. Part of that is that the audience for this information that we shared is not especially market savvy. So you have groups who say, we just want to know how to make condoms sustainable and equitable. We don't care if you use market language or not. So here is what our vision is for a healthy condom market. A healthy condom market would mean increasing condom volumes, increasing condom use across all populations, and that would include the high-risk populations, and a decreasing reliance on external funding. So based on that, we developed some principles for what donors should know before they invest in condom programming. And just to repeat, we were hired by the Gates Foundation to do this work, and primarily the audience for this work is the Global Donors Condom Working Group. So all of the funders of condoms who are trying to figure out how do you support condom market development in ways that are sustainable and equitable, and what is the best use of their funding going to be. So the guiding principles start with something very simple. Know your market. What we're finding is that there's a lot of investment going on in markets when people don't really understand what is happening in those markets. So when we visited these markets, we had trouble getting data and analysis. We saw a lot of kind of haphazard investment from donors that was at cross purposes or that was duplicative. A first step is know what you're getting into, know what the market looks like, know who the different market segments are. Mary will talk a lot more after my presentation about market segmentation. This is something that isn't widely understood by donors, and there's not always a lot of data available on it. The second principle is do no harm to the market. So what we found in a disturbing number of cases is that a donor approach of dumping a lot of free condoms in a market and not paying for any demand creation, not paying attention to the idea that there is commercial interest in the market, but flooding the market with free product, that actually does long-term harm to the sustainability of a market. The next principle is to invest in systemic corrections to failing market functions. So going into this project, we had donors asking us, should we keep funding social marketing of condoms? Should we keep funding government free distribution of condoms? And our answer to that is it's not about the team that you pick. It's not about do you want to fund Mary and PSI, or do you want to fund government programs? It's really at understanding, back to knowing your market, understanding what the barriers are in that market that keep it from functioning well and moving towards sustainability and equity. So we'll look at that a little bit more in the recommendations. The final principle is that consumer choice is key to growing condom use. So based on all of that, we developed some approaches and tools to help us look at markets. So you'll see here, and I won't delve into too much detail, but you'll see here the process we went through. Importantly, I'd like to point out that we started with a pretty extensive literature review and developed country archetypes and tools. We did a bunch of deep dives with stakeholders globally and locally. We did a lot of work on the ground with countries, talking to all the different market players on the ground. And then we developed some tools and standardized approaches. And then from that, we made some recommendations to address those market failures. So, as I said in the beginning, condom markets are interesting and illustrative, but there is not a one-size market development approach that's going to work for every product and address those priority needs for that product. In this case, based upon all the background research that we did and stakeholder interviews we developed three main buckets of areas that where we saw failures in the market happening. So one is on condom program stewardship. The main failures that we saw there were in terms of leadership and coordination, in terms of financing, in terms of policy and regulation. The next bucket, the main functions that were failing were around market analytics. So again, it was hard to know the market without much data. And then various failures on the supply side and the demand side. And then the final bucket was really failures around equity and sustainability. So if you look at these buckets, the one all the way on the left, the condom program stewardship bucket, that is really looking at the national level. So leadership, financing, and policy are all national level kinds of issues. The middle bucket is really looking at condoms as a category. So all different brands, all different market actors, what's going on in the condom category. And then the final bucket is really looking at condom implementation. So what's going on with various programmers and implementers in terms of equity and sustainability. So what we tried to do is to move away from two sector-specific focus. So here you see the typical total market approach triangle. What we're saying is that given the kinds of questions we were getting from donors about should I fund more at the top in the private sector, more social marketing, more public sector, we wanted to get away from picking a winner and picking a section of the TMA triangle to fund and to instead look at those functions we discussed. So this is just a different representation of looking at the interactions of the different functions in a market. So to break it down a little bit, these are some definitions that we used. So for condom program stewardship, again, it's work at the national level. So leadership and coordination would be the government responsibility and accountability for coordinating all the different market players from all different sides of condom programming. Financing is looking at coordination and a regular supply of financing from all sources to keep the condom program functioning well. Policy and regulation we found to be an issue in some countries where there were regulatory environments that made it very difficult for private sector players or social marketing players to do well in those markets. And the middle category, so the condom category, that middle bucket, we looked at market analytics, and in some places the data were better than in other places, but nowhere was it adequate for what we felt was needed to really fine-tune a market. Lots of problems in the supply chain. So problems in private channels, problems in public and social marketing channels, pricing issues, inefficiencies, so a lot of issues around supply chain. Demand was something that showed up as an issue in every single country we looked at. What's happened is that with all the years of funding for demand creation has dropped radically. So you'll see youth, for instance, young populations in various countries who've aged into a sexually active cohort, but who haven't been exposed to all the demand creation that we did for so many years with donor funding in various high HIV prevalence countries. And then the final bucket around equity and sustainability, just a bit of definition there. Equity means that condoms are available and accessible and attractive to all population segments, whether they are poor, whether they are disadvantaged in other ways, whether they are at higher risk, whether they are rural, whatever it is, that everybody in the population should have access to the condoms that they need. Sustainability, again, is the question of what happens when donor funding declines. Where are there places in the market where you can achieve greater sustainability and use your limited donor funding to apply subsidy in a very targeted way? So as part of this, what we did is we developed some standard tools, and we used tools like the one at the bottom, the UNAIDS Condom Fast Track tool. We developed some others of our own. We took and borrowed from tools that others have used so that we didn't really recreate the wheel. And basically we developed an assessment approach where you can go into a country in about a week to 10 days, doing some background research ahead of time, and come out with a pretty clear picture of what that market looks like and an understanding of where the kind of pain points are in market functions. Finally, we developed an online condom pathway dashboard. I'm going to try and share it here. This doesn't appear to be working. I'll send you a link to it. The idea with the dashboard is that we developed indicators and scoring criteria so that we could go in and take a quick look at a condom market and compare it to other markets in the region. So with that, we have all of the tools kind of open source. Everything is available. We've sent the reports to RHSC to put on the market bookshelf. And we're happy to share any of the data or any of the tools with any of you as we go along. Again, I wouldn't tell you that you could take these tools and apply them to oral contraceptives, for example. I mean, when you think about it, the channels of distribution would be different. The market actors would be different. There would be different kinds of criteria that you would put into your dashboard and put into your tools. But it is the idea that there is a process for developing this that could be applied across other countries. Sorry, I'm losing my voice here. So with that, I'm going to pass this on to Mary. The way we set this up is that I started more broadly with how you can step back and go and look in condom markets and get some ideas of how to improve those markets. Mary's going to go into some greater detail about how these things work. So Sophia, do you want me to stop sharing?
It's okay, I transferred it to Mary. You're all set.
Thank you.
Thank you, Chastian. Thank you, Sophia. And thanks to MDOC for inviting me to present. So my name is Mary Warsh, and I'm the Deputy Director of the Family Planning and Reproductive Health Department at Population Services International. And today I will share some of PSI's experiences on market segmentation. And I just wanted to mention that it is to my colleagues at PSI in the marketing department and the teams on the ground conducting market assessments and our funders that I owe a great deal of gratitude for that work and also for helping to prepare for this presentation. As a brief overview, PSI has done about 25 market assessments across Latin America, Africa, and Asia. These have focused on family planning, non-communicable diseases, sanitation, HIV self-testing, condoms, and malaria products. So I'm going to pull just a couple of examples today to discuss in terms of segmentation. And PSI's approach to market development is a systems approach where we ask two fundamental questions. Who is the market failing? And this puts the consumer at the center of the market system. And PSI takes into account her journey towards receiving the care, products, and services she seeks, as well as external factors that influence that journey, such as society, her community, and her interpersonal relationships. The second question we ask is, how is the market failing? Here we look at the value chain and all of the actors in the market involved in getting products and services to the consumer. We also look at any environmental factors, as Chastian mentioned, policies, regulations, and financing that might affect the value chain or the consumer's journey. The result is a map of the entire market system from consumers to manufacturers. And as you can imagine, this generates a wealth of information. So how does segmentation fit into this picture? Well, segmentation is a way to take the information generated by market assessments and organize it in a way to inform effective interventions. Segmentation takes broad populations and breaks them into smaller groups with shared characteristics. And there are many models and approaches to segmentation, but there really isn't a set standard. In some ways, segmentation is more of an art form, taking into consideration many characteristics and making choices on what's important. But segmentation is particularly helpful with large populations, such as consumers, as it can help prioritize limited resources by reaching more defined audiences in a more impactful way. So here's a basic example of market segmentation that you might be familiar with. Each one of these logos represents a separate and distinct retail clothing outlet. Each store targets a different segment of consumers. The Gap targets the age range of 17 to 25 with casual classic wear at moderate prices. Old Navy targets a younger age group as well as singles and parents and offers trendy clothes at more affordable, lower prices, but with lower quality. And Banana Republic is a luxury brand with higher quality merchandise and the highest price point of the three. And the interesting fact is that all three stores are owned by the same company. In this case, the parent company launched 3 different stores specifically designed to target smaller groups of consumers. They were segmented not only by age and price, but also by preferences. And the overall result would be reaching more customers and higher impact, which in this case would be sales. And by far, most experience in market segmentation is with consumers. And there are many types of different consumer segmentations. On the bottom of this diagram, we see demographic segmentation, which is very basic, grouping segments by age, gender, urban, rural, etc. The downside to this type of segmentation and using it alone is that it assumes each demographic group shares common needs and behaviors, which we know is unlikely the case. As you move up the funnel, the depth and precision of each segmentation increases and the information gathered becomes more useful. On the top, you have the gold standard for segmentation: needs, behaviors, and attitudes. And this is what the commercial sector has used for decades. It identifies motivations and willingness to change behavior among the subgroups in a target population. And this type of segmentation provides rich information to lend a deeper understanding of the behaviors themselves, the reasons behind behaviors, and also insights on how to influence them. But this does come at a price, as this type of segmentation usually costs more time and money to undertake. And I should also note that different types of segmentation can be combined or layered on top of one another. For example, you could further define a demographic segment through needs, behaviors, and attitudes, or any combination of the segment types here. Here's an example of demographic segmentation done in Ghana. This is a segmentation of married women based on wealth quintile and looks at use versus need of modern contraceptives. It's a good starting point, but it doesn't give any insights into the behaviors of any of the segments. As Chastian mentioned, you don't know the story behind the quality of the use or lack of use. It tells the what, but not necessarily the why or how behind the behavior. So if you were looking across the segments, you might target the highest quintile, which has the lowest CPR, the fewest users, and the highest need for modern contraception. But you'd be hard-pressed to design an intervention with this information alone. Zambia took a different approach to consumer segmentation for their voluntary male circumcision project. This work was done by a consortium of firms funded by Gates and used by PSI to inform a separate Gates-funded project. So this project enlisted a consumer research firm to conduct in-depth interviews with over 1,000 uncircumcised men. And this is an example of the gold standard behavioral segmentation at the top of the funnel. The interviews gave deep insights into the feelings, beliefs, attitudes, and barriers around circumcision. These were further informed by journey mapping. Groups were then segmented according to common insights. And you can see the names given to each segment. And these give an indication of where each segment is in their journey towards circumcision. On the left, we have rejectors, meaning this is just not for me. On the top, we have believers that are closer to actually getting a circumcision. And then on the lower right, you have hesitants that are somewhere in the middle on that journey towards circumcision. So the insights resulted in a rich archetype for each segment, identifying what's holding them back or pushing them forward and what they need to hear to get circumcised. Here's an example of one of the archetypes. I'm not going to read the whole slide, but even without reading it, you can see there's much more information here regarding the behavior, potential influencers than in the previous demographic-only segmentation. So going back to the different segments, you could choose to focus your intervention on the largest segment, which would be the indifferent rejectors, because you could say that's where the largest need is and where you could achieve the highest results. And this is especially tempting when there are donor deliverables at stake. But The team dug a little bit deeper and also looked at ease of conversion, meaning how likely it was that the segment would go through with circumcision. And for this, they used the level of commitment to getting circumcised expressed by the men in the different segments. And here they found that only 6% of the largest segments in different rejectors were committed. And other groups, smaller groups, such as friends-driven hesitants, self-reliant believers, and socially supported believers, were much more committed and therefore likely easier to convert. They also looked at the segment size, likelihood to become advocates, and risk behaviors in order to prioritize segments. And it was these three segments that came out on top, as they were thought to be easiest to change behaviors. And then they could focus more on the more difficult segments at a later date. Using the insights and data gleaned from the interviews, specific communications, messages, and channels were identified to reach and influence the behavior of each segment. And so this example shows the process from data to segmentation to the actual design of the intervention. But this shows only the consumer side. So we always need to link the consumer back to the rest of the market. One way to do this is with the 5 A's, and these come from USAID's primer on market shaping. The first is appropriate design. Do the products or services meet the needs of the consumer segments? Are they easy to use? Assured quality. Do consumers perceive the products and services as high quality, effective, and reliable? Affordability. Do consumers perceive the products, services as can the consumer segments afford the products or services? Do the prices foster discontinuation of use? Accessibility. Can the segment access the product or service? Are there stockouts? Are they too far away? Are there providers that are able and willing to provide them? And finally, awareness. Are consumers aware of the product or service? Do they want it? Do they demand it? Do they seek it? And do they know how to use it? The Zambia example focused on communication strategies to increase consumer awareness, but they also needed to make sure that the clinics providing services were appealing to the target segments, providers were trained in quality service provision and in the right locations, and that the price is right. So the 5 A's connect the consumer to the supply chain, and the consumer's main interface with the supply chain is with healthcare providers. So you can also segment healthcare providers. And PSI commonly uses a very simple matrix based on client volumes, actual or potential, and whether the provider is willing and motivated to provide the service or behavior. Programs direct interventions to the upper quadrants of this matrix first, as these providers are often the most productive because of the higher client loads, and then over time work with the lower quadrants to move them up in the matrix. The matrix is used to prioritize providers and allocate resources. I should mention that the communication strategies with providers is actually a one-to-one marketing or segmentation, which we didn't talk about, but these interactions are tailored to the individual needs and barriers of each individual provider. So segmentation is not only limited to consumers and healthcare providers and individuals. Every player or actor in the market or supply chain can be segmented. It's often simpler segmentation, but the key is that insights as well as environmental factors remain critical to shaping or influencing their behaviors. So here's an example at the other end of the supply chain with manufacturers for HIV self-tests from Kenya. It's a smaller market, and there are 2 types of tests, oral and blood. So the market was basically segmented based on the type of test, oral or blood. So OraSure is the worldwide market leader with an easy-to-use, relatively affordable oral self-test. But market research in Kenya showed that some consumer segments prefer oral tests, but others prefer blood self-tests. So it's important to ensure that both are available to meet consumer needs and ensure a healthy market. So how do we do that? Well, one problem with the blood self-tests is that they are basically repurposed professional use tests designed for medical professionals. These tests do not meet the appropriate design for consumers. They're difficult to use and prone to user error. Interviews with manufacturers revealed concerns that any significant changes to the test design would require restarting the approval process from scratch again, And there were also constraints concerning lack of WHO and national guidelines on self-tests, pre-qualification, as well as lack of clarity regarding registrations. So there was a lot of confusion in the market, and manufacturers just couldn't see a return on their investment. So with some detailed market analysis, including estimated market sizes and the market research demonstrating the demand for blood self-tests, coupled with a lot of work to push forward the introduction of HIV self-testing guidelines, 4 HIV self-tests were approved for use by the MOH in Kenya last year as part of a pilot program, including this blood self-test from Optimo, which is an integrated design for both blood collection and transfer. And you can tell just from the picture that this is a vast improvement in user friendliness compared to the repurposed test. And in this example, I have completely oversimplified the process and all that went in to get here with self-testing. For the purposes of this presentation. This was a huge endeavor involving a coalition of partners and donors, including the STAR Project, Unitaid, Gates, SIF, PSI, PEPFAR, Accenture, PATH, and many others. This example shows that market shaping can happen, but it takes a village. No one organization can do it alone. It takes a collective effort with each playing a role. So what have we learned? What are the keys to success? The consumer is at the center of market segmentation and the whole market system, but we need to link that consumer back to the market. Segmentation is key to organizing the wealth of information that we get from market assessments and to designing interventions. Insights and behavioral data are the gold standard and help us design more effective interventions. Be prepared to make choices. There's a lot of information, and the choices have to be made on which is important and which ones are going to be focused on. Definitely can't go it alone. The last example showed that it takes a collective effort of many partners and organizations working to shape markets. And last but not least, diagnose before design. The whole idea about the market assessment approach is understanding the total market and all the pieces before we jump to interventions to make sure that they are the most effective. That's all I got. Thank you.
Thank you so much, both Mary and Chastian. Those were really excellent presentations. I will encourage now those attendees to please write in your questions. You'll see there's a little questions box where you can write in questions. If you'd rather share your question verbally, you can also raise your hand. There's little hands you can raise on the webinar platform, and I can unmute you individually. I'll give it just a couple minutes for people to send in their questions, unless, yeah, I'll wait. We'll give it just a minute as people digest the presentations and can think of any questions they have. Okay, I see some coming through. So Chastian and Mary, do you see those questions? I can also read them out loud if you're not seeing them right now.
I see them.
And Mary, I'm just gonna stop.
I'm having a little trouble seeing them.
Okay, Mary, also we're still seeing your screen. If you want to stop sharing your screen.
Sure, thank you.
Okay. So sorry, Mary, did you say you can see them? I can't.
Chastian can see them.
Chastian, you can see them. Do you want to start reading them, Chastian? Then I think the first one's directed to you anyway.
Sure. So the question from Shannon, explaining country archetypes further. So when the Gates Foundation asked us to go in and get a snapshot of condom markets globally, but particularly in sub-Saharan Africa, one of the first challenges was to decide which countries we would look at. So we grouped countries according to what we anticipated would be similarities. So we developed kind of a list of if you go into a Kenya, for example, you're going to get a glimpse of what a more mature market will look like that's had benefited from a lot of years of funding. When we went into Zambia, we said Zambia is interesting because it's a case where the condom social marketing program that was run by one of the social marketers had no funding for 2 years. There was a 2-year gap when they had previously run a large portion of the overall condom program in the country. So we picked country archetypes that we thought we could learn lessons from certain countries and apply across other countries. And that, I think that's it for that one. Mary, do you want to answer one?
I think Mary was having a challenge seeing the question, so I can read one out, Mary. And although I think many of the questions are focused on Chastian's presentation. So one of the ones that just in general was, are the market assessments referred to available to other organizations?
Yes, they are. They're on my company's website. The reports themselves, Julia can confirm this from RHSC, but I believe that the reports are meant to be on the market bookshelf for RHSC. And then the tools and some of the data that we use will also be on the mannglobalhealth.com website. I'd be happy to send that stuff to you, Sophia, if you'd like to share it with others.
Yeah, that would be great.
Okay, there's a question here as well from Deanna, whether we looked at male condoms and female condoms as well. In this study, we just really looked at male condoms. We were not asked to look at female condoms, and there are other issues around female condoms that are a little bit more difficult to solve, so we did not take that on as well.
Great, and there's also one here for you, Chastian. Could you please elaborate more on the market assessment tools, like the fast track tool for HIV, and were any population-based tools used?
So, sure, the fast track tool for HIV was developed by UNAIDS, and what it does in particular is it helps you estimate the universe of condom need and start to understand condom use a little bit better in that context. In addition, we developed basic indicators that applied to those different buckets we looked at. So under the condom program stewardship bucket, for instance, if we were looking at leadership and coordination, for instance, we would have indicators around whether or not the country had a condom strategy, whether or not all the different market actors were involved in that condom strategy, whether or not there was a market steward who was coordinating the work of different market actors. So the dashboard that I wasn't able to open the link to will show you, it'll break down all those different indicators and it'll show you the weight of each of the indicators. So when I send Sophia the information and places to find all of this, one of the things that data people find interesting is looking at the dashboard and understanding how we sort of arrived at our analysis.
Thank you, Chastian. Also, we have one here that's for Mary. If individual projects wanted to take on a market segmentation exercise in order to improve programming, what resources would you direct them to?
Thank you, Sophia. Yeah, there are a lot of resources available for market segmentation, but I think that, and my colleague, Shannon Rosenberg can help me direct you to those resources. But I think, as like I mentioned, one of the big things is making choices and deciding how to go about it and what you're going to look at. All the information is really great to have, but sometimes you can actually have too much information, so you need to have a careful balance about that. So having a clear idea of what you're looking for and being able to sift through that is quite critical for the market segmentation. Shannon, I don't know if or Sophia, I don't know if you can unmute Shannon. Yeah, great.
I just did. Yeah, I just unmuted Shannon.
Great. So can everyone hear me?
Yes.
You're very quiet. If you can.
Sorry, I'm sitting in the middle of a conference room right now. But I'm Shannon Rosenberg. I'm the Market Dynamics Advisor at PSI. In terms of resources, there are quite a few for consumer segmentation out there, and I'd be happy to link in with Sophia to send what some of those are. I believe we have a kind of a consumer segmentation database on the different strategies, and a research selection guide which helps you think through which of those segmentation strategies could be best for your needs. For the market side, in terms of segmenting the rest of the players in the value chain, I'd have to say that there's still not quite a really good resource out there. I think we're still learning how to do that well. It's something that our team is working on right now, but from my perspective, I don't think there's a really great resource to think through how to segment actors. The key piece of it, though, is really just empathy. The thing that we're learning, for example, those HIV self-testing manufacturers, is trying to understand why they're doing what they're doing and they're offering from their perspective. You know, you can have, just like with consumers, tons of information, but figuring out what of that information is most important and how that changes their behavior is what you kind of need to drill down to. So the best thing that we've just learned from that perspective is talking with all of those market players is what really helps get you to that point. So I'd be happy to share the consumer segmentation resources though.
Great, thank you. And I think what we can do is, after this webinar, we can circulate a recording of the webinar with all these resources that have been mentioned. We can put together one email and have this all in one place, because these are a lot of great resources. Yes, and actually, again, another plug for Market Bookshelf, because as we get these resources and get approval, they will all be put on Market Bookshelf, which helps you to have a one-stop shop to actually be able to search and find these types of documents. I've seen that there are a couple of questions that have been repeated, so I wanted to flag it because it seems to be an important one. There seems to be a question about, is there data out there about the condom market in Latin America? This seems to be a common question.
So we did not look at Latin America as part of the study, but there are plenty of data out there. In some cases, Latin American countries, I think, are better at capturing those kinds of data. So I think maybe what would be helpful is if you look at the sorts of approaches that we took to track down data, and to see if you could recreate that in Latin America. Because our focus was mostly on looking at donor priority countries, to have this be one of the tools that donors consider in decision making about funding to condom programs, Latin America doesn't usually rise high on the list of where donors are going to put condom funding. So it doesn't mean that the data aren't there or not worth looking at. It just means that they didn't really, Latin America countries didn't really rise to the top of the list.
Thank you, Chastian. So this is a question for Mary. Tandi's saying, as you noted, there are costs of different approaches that vary across the system, and many of us tend to do demographic market segmentation because the data is readily available. Are you seeing support or investment by donors in conducting other types of segmentation studies?
Yeah, that's a very good, interesting question. I think a lot of times we rely on the demographic because that's the information that's available. And in the Ghana example that I shared, that was an analysis that PSI did on their own with available data. But we are seeing more and more funders looking towards taking that more human-centered design approach and really understanding the market, because they know that the results are better targeted intervention. And with value for money being also very topic these days, I think it's worth that investment if we can show positive results from it.
So Sophia, there's a question for both me and Mary from Elizabeth, where she says that my presentation specifically mentioned shortfalls in behavior change and demand generation work in the condom market. Mary's presentation mentions the importance of insights and behavioral data. A general question for the two of us is, what are our recommendations for the directions for the family planning field, given that we are in a time of overall funding constraints? Can we recommend more commitment to demand generation and market development work? I would say, and Mary, jump in after I'm done, but I would say that that my company has done an exercise for UNFPA as well, and doing a quick overview, not with a level of depth of this condom assessment, but a quick overview of the status of markets in 10 African countries around different contraceptives that UNFPA supports. What we saw in all of those cases is that demand generation is universally a problem. Data for decision making is universally a problem. And any kind of market facilitation and stewardship is universally a problem as well. Mary can jump in with some more details of what they've seen on the ground, but off the top of my head, in areas where we recommended to UNFPA, as well as in the condom field, demand generation for sure, better data and market analytics, and by data I also mean understanding of consumers, and consumer segmentation would be part of that. And then better stewardship, better kind of coordination of all the different functions as well as the different actors in those markets. Mary, do you want to take it from there?
Yeah, I would agree with Chastian on that. And some of our market assessments, for example, in Pakistan, getting to know the consumer was really important, and we still have some work to do there. But what we found is awareness among consumers for modern contraceptives was really, really high. But that wasn't necessarily translating into the demand. And manufacturers, distributors were relying on the social marketing sector to create that demand. And what they meant by that exactly still isn't exactly clear. And what we also found was that there were a high number of discontinuers. So again, we need to delve deeper into that, but for some reason or another, maybe perhaps due to side effects, not being anticipated, women were discontinuing their method. And so that again can go back to providers and strengthening providers' counseling skills so that they can counsel clients on contraceptives that meet their lifestyle, counsel them on side effects and what to expect, instead of what's usually done, which is counseling on the method and effectiveness and how the method works, which doesn't mean as much to a client in terms of how it affects their lifestyle. So I think those are some examples of where we definitely need more targeted interventions and need to know more in order to increase use and target funding to the appropriate interventions.
Great, thank you both for that. There are a couple more questions, so we have a couple more minutes, so that's good. There was a question about, does the universe of a need analysis come from the willingness and ability to pay studies? And are there any other alternatives for willingness and ability to pay you would suggest?
So I don't have handy all of the calculations that UNAIDS did to build their universe of need assessment. I know that it's available online on their website. Mary, you probably can speak more to the question about willingness to pay and how you can do different models for getting at willingness to pay depending on how big your budget is as well.
Yeah, that's the key question. How big is your budget? But yeah, willingness to pay is very important in terms of the consumer segmentation to make sure that we can meet the needs of the consumers. But the level and depth depends on how much funding you have. And sometimes we think about willingness to pay as a simple question, like how much would you pay for this, or would you pay for this? And you really need to dig deeper into that to find out what's valued about something, what a consumer would pay for, what they're not willing to pay for, and what are those particular attributes and characteristics. So again, it goes back to the gold standard of looking at the needs and attitudes and behaviors in segmentation, which often requires more in-depth interviews, more time, more money. So it depends, on the funding that you have in order to do those, but it's certainly important.
Great. And then one last question from Andrea is a question to Chastian on the point of free products flooding the market. Could you comment on any findings from your work related to incentivizing the private sector, particularly commercial distributors?
Sure. I note that we have 3 minutes left, and that's a great big question. But what I would say is that what we are finding is, in fact, that too much free product in a country and too heavy a subsidy for socially marketed products in the country is a barrier to private sector entry and private sector sustainability in a country. You could see how that would be. It's hard to compete if there's a lot of heavily subsidized or free product in a market. One thing I want to point out, because people always kind of take us to task on this idea of the private sector and what their interest will be in any of these markets. So when we're talking about condoms in particular, and we talk about encouraging greater private sector participation in the market, we don't mean that we think that Durex condoms are going to launch a big operation in Malawi. What we see instead is that the private sector that is actually gaining traction in some of these countries are small importers. So it's small companies that operate on tiny margins with small overhead, importing regional or even other branded condoms. So it's the mom and pop shop. It's the family that has a small warehouse and has other products as well. And those guys in places where pricing of social marketing condoms is more appropriate, in line with the market, and where there's not too much free condom spread all over the country, those guys are actually gaining some traction. So what we've said in terms of recognition is free products need to be carefully targeted. They should not be dumped. Social marketing products, of condoms in particular in this case, should be targeted. They should also not be dumped on the general population if they are using donor funds. So if DFID is funding a social marketer to do a condom program in a country, it should not be funding mass distribution of that condom. It should be funding more targeted distribution. It should be funding demand creation. It should be funding different social marketing actions that can improve market functions. But distribution to the general population should really see a much greater and growing role of these small importers and private sector distributors. So I won't belabor the point, but that's kind of the quick overview of what we have recommended.
Well, I'd just like to, this is Julia again, Julia White, and I'd just like to thank both Chastian and Mary for both the excellent presentations as well as for comprehensive answers to the questions. I'd like to thank all the participants for all of these excellent questions and being very involved in this webinar. And I'd just like to put out another plug that we will be doing another MDA webinar in February, and we will be sending out the email and calendar invite with all the details. And thanks very much to Elizabeth and as well to Andrea Bear, who helped us to organize and get these webinars in place, as well as to Sophia. So thank you everyone for this effort, and looking forward to having everyone's involvement in February. And we'll circulate a recording and those resources as well. Thanks everyone.
Thank you.